Thank you for joining us and welcome to today's research webinar on assessing the mobility needs of rural and underserved communities in California. I'm Sarah Schramer, Policy Director at the National Center for Sustainable Transportation. Housed at the Institute of Transportation Studies at UC Davis, the National Center for Sustainable Transportation is part of the University Transportation Center's program administered by the U.S. Department of Transportation. The NCST provides national leadership in advancing environmentally sustainable transportation through cutting-edge research, direct policy engagement, and education of our future leaders. Slide too far. Our university our National Center works in partnership with a consortium of 7 universities, including California State University Long Beach, Georgia Institute of Technology, Texas Southern University, the University of California at Riverside, and the University of Southern California, and also University of Vermont. Today, I'm pleased to introduce our speakers. First, we'll have Dr. Caroline Rodier of UC Davis, whose current research interests include the development and evaluation of shared mobility services designed to meet the needs of transportation disadvantaged populations, as well as Dr. Jesus Barajas, also of UC Davis, whose research at the intersection of transportation, planning, and environmental justice addresses how systems of inequities influence travel behavior and how policymakers can and should respond. And before we jump into the presentations, I just wanted to go over a couple of housekeeping notes. There's going to be time after each presentation for questions, and we'll open up the floor for Q&A at the end as well. Please use the Q&A feature in the Zoom webinar platform to type your questions, and we'll do our best to answer all of them. And if you're having any technical issues, please feel free to use the chat box. We're going to be recording this webinar, and the recording will be available on our website, along with the presentation slides in the coming days. You'll see a quick survey at the end of the webinar for you to share your thoughts with us on today's presentations. So please take a moment to fill that out for us, as it's part of our reporting process as well. And with that, I'll go ahead and pass it over to Caroline. Let me stop sharing my screen. All right, there you go.
Okay. Share my screen. Okay, good morning. Today, I will discuss findings from an electric vehicle car sharing pilot in underserved rural areas in California's San Joaquin Valley. So the San Joaquin Valley is California's single most productive agricultural region and one of the most productive in the world. In this map, you can see that the valley is dominated by agricultural lands. The smaller pink areas are residential and commercial lands. California has classified most of the valley as experiencing a high level of economic and environmental challenges. It has some of the worst air quality in the nation and high rates of childhood asthma. So I'm going to just start quickly with the pilot origin story. The San Joaquin Valley transportation agencies wanted to develop a path to increase access and reduce GHG emissions in underserved rural areas. Agencies partnered with UC Davis researchers, and we embarked on a community-based planning study in 2013. So it's 10 years ago now. That identified underserved communities, compared shared mobility service concepts, and developed community partners. It culminated in a consensus about 3 pilot options, one of which was car sharing. The pilots were funded by the California Climate Investment Fund, otherwise kind of commonly known as the cap and trade. So I'll just give a quick word about our alternatives analysis. At the time in the valley, ride hailing, Uber and Lyft served larger cities. And there were limited car sharing service, I think 2 sites total in the region. Both of these services have really declined during COVID and since then relative to 2013. But anyway, our analysis examined the cost effectiveness of ride hailing and ride sharing and car sharing compared to fixed route and demand responsive transit. And we found that commercial ride hailing and car sharing was potentially viable with incentives to address, deadheading costs, what it would cost to drive with an empty vehicle to pick someone up or return with a passenger empty vehicle to go back, say, to a city. However, at the time, the companies were not really equipped to modify their service to develop these kind of incentives. We looked at car sharing in a number of the communities, and this showed a greater potential to serve more underserved rural areas in the valley. Ultimately, the funded and implemented pilots included electric vehicle car sharing in the Southern Valley, the results of which I'm going to discuss today. This was in Kern and Tulare County. We also implemented a volunteer ride-sharing service in the Northern Valley using a back-end system of a well-established volunteer transportation organization in upstate New York. And we also developed a mobility as a service smartphone app, which is still being used and expanded in the San Joaquin County, the northern area. This alerts people to the current transit system, allows for transit planning, payment for transit, and integrates new shared mobility services as they come online. So for example, in San Joaquin County, they've just recently introduced MioCar, the electric vehicle car sharing pilot. And so you can now see where that's available and trip plan with it. Okay, so we implemented as part of our kind of feasibility analysis, focus groups with car insufficient households in some of our proposed pilot areas. So I'm just giving you a brief highlight of these results. We explored participants' current challenges, and some of the key concerns that they expressed were kind of being uncomfortable requesting rides from friends and families. They didn't want to burden them. There were some people who you could pay for rides that may not be friends or families. However, there was a high cost for these rides, often more than $100. There was also complaints about infrequent transit, perhaps one round trip a day, and then long transit travel times that could range from 2 to 3 hours. There was also a lot of discussion about missed work to drive family members to medical appointments. Say, if you had a larger family with just one vehicle. So when we asked participants about travel needs, they expressed that many destinations were not easily accessible to them. We also asked about attributes of car sharing services. They expressed that these services should be affordable. Training and engagement was needed early on. Also, a range of differently sized vehicles would be helpful. And there were many large families in the communities that we were serving. And then, they wanted hubs that were easily accessible, not too far away for them to travel to. Okay, so about the car sharing service. The pilot evaluation ran from 2019 to 2022. Unfortunately, during the time of COVID, but we were able to collect data on the user experience and how people used the service. But the electric car sharing service that was actually developed for the area is called MioCar, and that was, the name was actually identified in a meeting with stakeholders in the different communities. It is an electric round trip car sharing service. It's primarily associated with affordable housing, self-help enterprises. We had 8 hubs in 6 rural communities in Kern and Tulare counties. The fleet included 27 vehicles. We had largely used vehicles, sedans, and 2 plug-in minivans. The cost of the service is really below market rate, $4 an hour, $35 a day, a little bit higher for a weekend day at $45. You're able to reserve a reservation using a smartphone app, a website, and a regular phone. And there was initially kind of an experimental group of people that implemented the program. Shortly after that kind of ramp up phase, the service transferred to local nonprofit operations, and it's continued as such to the current time. So our evaluation, we use data from member reservations, initial surveys, post-reservation surveys, and a final survey. So the initial surveys were implemented via email. Post-reservation surveys were implemented via email quickly after someone completed a reservation. And the final survey was by telephone. It included structured and unstructured questions. So all the data sets are connected by an anonymized ID for each member. We had complete access to the reservation data, and we had a pretty decent survey response rate. It ranged from 40 to 50% of user members. About 375 people joined the service, and more than 150 members used the service at least once. And again, use of the service was impacted by COVID and reduced travel activities and other challenges during the service, which included significant issues related to Bolt recalls. So, okay, how does our sample population compare, to relevant census data? So relative to the census, the sample population of MioCar users are more likely to be younger and higher educated and belong to larger low-income households that tend to be car insufficient. The average age of MioCar average age of a MioCar member's vehicles were approximately 11 years old. So, there may have been reliability issues even among, those people who appear to be car sufficient. Our survey respondents indicated that they are largely dependent on personal vehicles to access essential destinations, and can rarely do so by transit, walking, and biking. And I think you'll see this in Jesus' presentation as well. So respondents indicated that prior to joining MioCar, that they had to ask for a ride from someone else or borrow a car or rent a car to travel to work, school, and medical appointments. This share is almost equal to that of, those using a personal vehicle to get to those destinations. Again, transit, walking, and biking were generally not viable modes for these destinations. Okay, this slide delineates different categories of low-income households below actual community median incomes. And this is the household size and income categories used by the U.S. Department of Housing and Urban Development, or HUD as commonly known. So this is generally how we categorize income from this point on in the presentation. You know, it's useful. There are a lot of larger households in the Valley, so it is useful to adjust income for larger households. So as you can see, the pilot was well used by low income populations. 69% of respondents are in the lowest 3 income categories, and 31% were in the extremely low income categories. So these categories, as I mentioned before, are used in the rest of our analysis. So in this map, you can see basically where our pilots were located, our pilot hubs were located. They're indicated by the green dots with the orange arrows. Again, that represents the MeoCar hubs, and the size of the orange circles represent membership areas and area communities. So, you know, this map and then the chart of, to its side indicates that many members lived outside of MeoCar communities. So actually, you know, kind of we have a U-shaped chart here. 28% live very close to the hubs, and 29% of members live more than 5 miles away from the hubs. However, we did find, you know, we conducted statistical analyses that, you know, people who live closer to the hubs actually used the service much more frequently. So it, you know, really more hubs with fewer vehicles are needed in these areas. However, EVSE installation takes time and is costly. More streamlining and incentives are needed, and I'm going to discuss this a little bit more in the conclusions later on at the end of the presentation. Okay, so the post-reservation survey, that's the survey that we implemented after people had completed a reservation. We asked members how they would have traveled to the destination, their primary destination, without MeoCar. 58% said that they would not have been able to travel without MeoCar. So our analysis, again, of the post-reservation survey data indicated that most members who said they would not have traveled without MeoCar would have done so with a conventional vehicle. Only 1% would have taken transit instead. So again, we use the post-reservation survey data and, you know, our reservation data, and we found that 24% of pilot electric vehicle miles traveled, or EVMT, substituted for internal combustion engine VMT, or ICE VMT. And 54% of pilot electric VMT was new electric VMT to meet unmet travel needs. We also found a positive relationship between new electric vehicle travel and low-income users and substitution of electric vehicle travel for internal combustion engine travel among higher income users. So low-income participants are more likely to make new travel to address unmet travel needs, and high-income participants are more likely to substitute for electric VMT for conventional VMT. Again, we use the HUD household size adjusted income categories for this analysis. And, you know, these results really point to the magnitude of unmet travel in these communities when households are not able to afford a personal vehicle. Okay, additional findings. So we did see that from the final survey, we did see that personal vehicles were being shed, and there were some vehicle suppression effects. About 5% of members shed one or more vehicles, and about 4% of members delayed the purchase of one or more vehicles. I was actually pretty surprised about the shedding, given the high need for vehicles in these communities. MeoCar also helped complete time-sensitive travel, such as appointments for work, medical, and school trips. Members were satisfied with service quality and ease of use, but again, were less satisfied by the distance they needed to travel to access car sharing hubs. So what's going on with MeoCar now? MeoCar has secured funding to expand its fleet to 75 vehicles in California over the next couple of years. It's expanding in the city of Stockton and San Joaquin County in the Northern Valley. Also the city of Richmond in the East Bay area, and to more sites in Kern and Tulare County. And UC Davis continues to evaluate these expanded service, working cooperatively with MeoCar. Okay, benefits of electric car sharing. So electric car sharing may be a promising policy option to consider to reduce greenhouse gas emissions while promoting equitable access. When subsidized, it can provide an affordable travel alternative, particularly in rural and suburban areas where high quality transit is costly to provide. It can also increase exposure to electric vehicles, which may translate to greater acceptance, and adoption of these vehicles. Electric car sharing partnerships can facilitate EVSE installation in underserved communities and serve as an anchor client where there's concern about EVSE use, to sustain private operating services. Again, evaluations are needed that verify and quantify the benefits and costs of these programs and inform longer-term government investments in electric car sharing services. And I can share some of the challenges of electric car sharing, based on conversations with Gloria Huerta, the COO of MeoCar. Electric vehicle car sharing can be more expensive to provide than conventional or hybrid car sharing, because it requires installation of EVSE, again, which can be really costly if it's not subsidized. I mean, increasingly in California, some areas are subsidized, but it's a non-trivial cost. It's also time consuming just to get property owners in good areas, in areas which where the service will provide a high level of accessibility, to agree to allow construction on their site. So this can limit the number of stations available for service, especially when you're in a grant with a tight timeline. So there's often limited availability of fast chargers in and around pilot areas. This is particularly a concern in rural areas in the southern San Joaquin Valley. So we experience frequent recalls and long repair times due to the Bolt recall. That has been a real issue. Because of vehicle repair issues with these electric vehicles, MeoCar recommends 2 vehicles per station. More time is required to train members on how to use electric vehicles, more engagement and outreach. There's a greater likelihood of on-call support, more on-call support, and emergency response needed to deal with electric vehicle specific issues, such as running out of your battery. running down your battery. For inexperienced users, that can be an issue. However, we think these are short-term problems. Accessibility benefits are less in the short term. Accessibility benefits are less in electric versus conventional vehicle car sharing service. However, over time, as the technology matures, hopefully many of these issues will be resolved and costs may be even lower. And I think it's also important to note that, we tried to use affordable vehicles for this pilot, given we wanted to maximize the availability of vehicles. And so we tended to buy lower cost vehicles as opposed to the Teslas that are, quite expensive. So our recommendations, I think I am over time. I'm sorry, but I'll just quickly identify underserved communities for priority funding, support high quality feasibility and planning studies, include community-based partners as co-equal compensated team members, avoid reimbursement contracts. It makes it harder for community partners to participate, provide ongoing funding for successful pilots to scale, especially where the private sector is unlikely to fill in service gaps, and set a high bar and be patient. These are tough projects to implement, but they can also be tremendously beneficial to participants. I'd just like to acknowledge my co-authors, Brian Harold and Yunwan Zhang from ITS Davis, as well as Gloria Huerta, COO of Meocar, and for her ongoing support with data collection. Just a shout out to the Meocar team and our project partners. And I have a list of reports if anyone is interested in knowing more about these pilots. Thank you.
Thank you so much, Caroline. I think I mentioned this already, but we will have Caroline's presentation up on the webinar website. And then I noticed we have several questions in the Q&A box. So Caroline, I wanted to suggest if you want to answer any of those through typing while Jesus presents, we can go that route. And then any questions that you'd like to reserve and answer live at the end, we can do that as well. So I'd say just, pick and choose which ones you want to answer via typing, and we'll save the rest for the end, if that works for you.
Okay, great. Thank you.
Great. Thank you. All right. And I'll pass it over to Jesus.
All right. Thank you, Sarah. Okay. Good morning, everyone, and thanks for joining. What I'm going to talk about is kind of zooming out a little bit and providing some of the context for many of the issues that Caroline already talked about in her presentation, talking about mobility justice in rural California and focusing on folks who don't have cars or may not have a sufficient number of cars in their household, or they have sort of more travel needs, or people who can drive than vehicles available in their household. So I'll set the context to talk about carlessness kind of in general across the United States, and then focusing on what we know about carlessness in rural areas. And then we'll get into some of the data analysis that we did, looking quantitatively at the scope of car access in rural California, qualitatively at interview themes that came up with interviews from residents of the Central Valley, and then kind of share some recommendations and key policy issues that came out of this, and kind of setting the stage for future work. So what do we know about people who don't have cars in the United States? In general, carless households are lower income or otherwise structurally disadvantaged. So roughly 40% of households that earn less than $5,000 a year are carless, so very, very low income. And on the other hand, those who are sort of middle income or above, only 2% of those are carless. But 75% of carless households earn under $35,000 a year, and Black-headed households, immigrant households are more likely to be carless than others. We know that access to a car isn't static or binary. People transition into and out of carlessness depending on life circumstances, age, kind of life status, job status, age range, income. People sometimes own cars, sometimes they borrow cars, sometimes they use car sharing services, or otherwise get rides from friends and family. We know that access to a car is sort of critical for economic outcomes. It often contributes to higher job earnings, keeping and maintaining jobs. And when you don't own a car, that access is often negotiated through friends and family and social networks. And as Caroline alluded to, there may be some kind of stressors and challenges associated with that negotiation and borrowing. But even for folks who don't have a car travel is still important, and about a quarter of trips in zero car households are made by cars. When we focus on rural travel in the US, whereas about 9% of US households don't have any vehicle, about 7% of rural households are carless. And this is kind of a significant challenge if you think about this landscape, the land use, the travel distances that folks in rural areas need to go. If you don't have a car, it does make it very difficult to get around. We also know that there are challenges with traffic safety when it comes to rural travel. So 45% of traffic fatalities occur in rural areas, where only 20% of the US population is rural, and 30% of VMT occurs in rural areas. So significant disadvantages associated with this car travel that takes place in rural areas. Rural residents also have other sort of access and mobility challenges, where there are fewer out-of-home activities, fewer job opportunities, have to travel farther to get to medical appointments and kind of other necessary activities, and are more likely to miss those medical appointments or other kind of necessary travel destinations because of those travel difficulties. So our study here was trying to put some numbers to these phenomenon in California in particular. We know a lot about kind of urban travel in California. We know a little bit about rural travel across the US, but we wanted to focus on rural California and looking quantitatively at the scope and scale of car access, and then qualitatively at some of the barriers that zero car and car deficient households face, and the adaptations that they make to meet their travel needs. I think this is particularly important because car access is expensive. There are concerns that it's going to become even more expensive as we approach this 2035 100% EV new car sales. And alternatives are difficult to implement in rural areas because of the lack of density in the built environment and long travel distances. So what we did was, again, as I've been kind of alluding to, we did a mixed method study here where we looked at some of the quantitative data. We looked at qualitative data. We looked at, to kind of quantify the scope and scale of car access, we used American Community Survey data, but we looked at the public use microdata sample. And the benefit of this data set is that it's individual attributes, so disaggregate data that has things like car access, household income for individuals. The challenge, though, is that because to maintain privacy protections, the geographic areas are quite large. The public use microdata areas are something like 50,000 people or so. So we had to do a little bit of educated guessing on how we're describing rural areas because these areas encompass both urban and rural areas. So if these public use microdata areas were had a significant share of rural areas, we classified them as rural. So again, we're kind of getting some urban areas, but a lot of places where there's a lot of rural residents as well. And we're doing some rural and urban comparisons so we can kind of look at the difference and the particular challenges that rural areas face. Then we did some interviews. We interviewed 22 participants from carless or car deficient households. The map here on the right shows where those interviews took place. We partnered with Self-Help Enterprises, who's partnered with Caroline and a number of other researchers at ITS Davis to help recruit these individuals. So folks that they work with. About half our participants lived in Visalia, and then the other folks were in Merced, Lee Grand, Biola, Fresno, Woodlake, and Farmersville. We asked participants, our interview participants, to fill out a short survey that captured some of their car borrowing, car sharing, and carpooling habits, their major transportation costs, their plans to purchase a vehicle. And then our interviews focused on some of the same things, but also digging deeper into travel burdens, daily travel difficulties, adaptations and resources that they use in lieu of having a vehicle, and then some policy solutions that they felt would sort of make their lives easier in the context of not having a car. We did do our best to include Spanish and English speakers in our sample, and folks lived in a variety of settings here, but we did include those who lived in multifamily housing in smaller rural communities, and a sample of farm workers as well. So across California, as I mentioned, there's a smaller share of people who don't have cars compared to urban areas, but still we see in California about 5% of rural residents don't have a car, and then 18% have fewer cars in their household than the number of adults. So we label this as a car deficient status, and about 77% have at least one car per adult. We find that more of these carless and car deficient households live in the Central Valley. So that's indicated here by the darker red colors on the map. We think that we see these patterns there because there are a lot of large towns and small cities adjacent to the rural areas. There are some alternative transportation options in the Central Valley, although not robust, as Caroline was alluding to earlier. But also larger farm working communities, lower incomes, and fewer resources for car ownership are other things that drive those patterns. And of course, we do note that those concentrated areas of limited car access really do overlap with pollution burden areas and sort of intersect with environmental justice issues. If you don't have a car in a rural area, you tend to be more disadvantaged than you would be in an urban area. So household incomes are lower compared to urban areas for zero car deficient households, and that's even the relative share of income, as the average income is lower in rural areas anyway. We also see kind of more people of color who have no cars or are in a car deficient status, both in rural and non-rural areas. We do see that rural households are more likely to travel by a car, even when they don't own one. So if you look kind of at the zero car chart here in the middle, we see about a quarter of people without a car in non-rural areas will drive alone for their commute to work, which is what the census reports. But almost half of folks drive alone if they don't have a car. And again, this goes back to the sort of necessity for car access and strategies like borrowing vehicles or car sharing to get that car access. So switching to our interviews now, again, we interviewed 22 folks from the Valley community, Central Valley communities that I described earlier. There were on average 1 car per household, but just over a quarter of them didn't have a car. Folks who how they got around in the previous week, about a third drove their own car, 9% drove a shared car, 59% got a ride from someone, and then 18% used transit. So a high, relatively high share of transit use compared to kind of rural transportation trends in general. Our participants would borrow cars a few times a year. They'd get a ride 1 or 2 days a week. They'd use car sharing a couple times a year, a few times a year, but a significant share, about a third, used it once a week, and they spent about $260 a month on transportation. And if the cost of transportation were to increase, most people said that they'd have to make major changes to their budget, but the majority would still use the same mode of transportation, sort of illustrating the effect that increased transportation costs might have on their lives. More than half weren't planning to buy a vehicle in the next 5 years, but we did have a few that indicated interest in purchasing an electric vehicle. So what were the challenges that they faced? So the folks who had no vehicle access or limited vehicle access did rely some on public transit. So particularly there is a transit service in Visalia, and they relied on car sharing options, but with great difficulty, describing kind of unreliable transit. We did these interviews in the summer, last summer, in the heat wave, and this 104-degree heat was really weighed on people's minds. We had a resident who talked that it was about a mile for that person to walk to the bus stop. It's 104 degrees outside. It's pretty far to walk there for this person and their children. And then when they got there, the bus took forever to get there, and it takes an hour then to travel where they needed to go on the bus, and they described it as pretty terrible. And in this context, they might forego these trips just to avoid the burden of this travel. And some illustrative quotes here from our survey participants. And so just to kind of illustrate what the conditions are in this area of California. So this is Goshen Road in Visalia, and there is a bus stop in this picture, believe it or not. And it's right there under the 50-mile-an-hour sign. So you see that the infrastructure doesn't really support safe and effective transit use in some of these areas. We also talked to people during a time of the gas price spike last summer, and every interviewee that we talked to mentioned these gas prices. To compensate, they would cut down on their daily local trips, and most cut out their long distance trips. Some saw electric vehicles as a potential solution to high gas prices. So there's kind of benefit or hope for among some that would alleviate these spikes in prices. So here, this resident from Visalia wouldn't go to visit her mother because they drive in an older vehicle, and it was too expensive to fill up to make that trip. Another interviewee who carpooled also talked about it affecting their ability to travel, because if they wanted to get a ride from someone, they would have to pay them $40 for gas, and they felt like they had to bribe someone to be able to give them a ride. Some of the folks we talked to used medical transportation services and dial-a-ride services to get around without a car, but they weren't well liked because the schedules aren't flexible. You have to call in advance to reserve the service, and you're sort of at the mercy of when they can come pick you up. And the long distance trips are necessary, but they're difficult to service because of the long wait time for like a medical appointment. So this person talked about a medical procedure that they had to get done, and they couldn't guarantee a ride back because of the distance there. So they had to skip out on this particular medical procedure. In our farm worker communities, we saw some particular challenges that were unique to this group of people. So they also saw a lack of transportation options, and because of work sites, there was no transit options, and they were unable to rely on employers to organize rides where they felt like that was something that should happen. And unreliable transportation is really a challenge for this group. They would get sent home if they were late, and others had already filled the labor quota. So they would walk for miles to meet with their carpool partners to get to the labor sites, the farm labor sites. Interviewees, we asked them about what they saw as alternatives to car ownership, and so they really wanted to see expanded and subsidized use of ride hailing and delivery services. And some found that these deliveries were lifelines during the COVID lockdowns, and hope that would be a service that they'd be able to take advantage of even after COVID. The folks who were able to use transit for their destinations wanted better transit service, better locations, more service hours, and more flexible medical transportation, and potentially some help in structuring carpool matching. So the Bay Area casual carpool came up as an example of how folks thought that their carpool experience might be improved. And another key solution was better engagement from elected officials. They wanted their elected officials to be outside waiting at the bus stop with them when it was 100 degrees out, when it was raining, and have them experience the same service that they were experiencing, so they would understand the necessity of engagement, or the necessity of investment in better infrastructure and better service. So some of the kind of questions that come out of this work that hopefully this will inform, we see shared car access as a potential solution, and Caroline talked in depth already about sort of how NeoCar has been filling these car access gaps and meeting unmet travel needs. The question is, we see this scaling a bit, but there are significant challenges with the types of vehicles, the cost of vehicles, and whether community-based organizations and subsidized car sharing can work at scale. So for those who think they need their own vehicle, what are the options to provide car access in these cases where scaling might be difficult? there is a desire for and a need for non-automobile transportation to kind of supplement what people rely on their social networks, on transit for people who don't want to and can't drive. And so how are ways that we can kind of serve these areas without 100% vehicle access. And then questions have come up about sort of what the EV transition means. That could mean less expensive in terms of kind of the fuel costs, but people do fear that these vehicles cost more and they'll be unable to use them. They'll be unable to purchase and they'll be unable to operate them when they have them. So I'll leave it there and reserve the last few minutes here for questions.
Thank you so much, Jesus. That was a great presentation. And Caroline has been furiously typing away in the Q&A box while you've been presenting. So that's great. I think we've answered most of the pending questions here. And there's one remaining for Caroline. Can you talk more about the car share transition over to the local nonprofit and who were they?
Yeah, originally we worked with Calvans. They were the fleet. They owned the fleet, insured the fleet, and repaired the fleet and cleaned the vehicles. However, you know, as COVID approached, we had the end of our 1 year, we decided to transition, and Calvans was a farm worker. They provided rides to farm workers with these vans. Basically, someone would drive a group of people to the fields and back. So they were in a good position to do that. There were some issues with insurance at Calvans, so we switched over to you know, we filed the paperwork for a nonprofit, and the nonprofit then was able to, they own the vehicles, insured the vehicles, and maintained the fleet. So that's basically how that worked. Oh, someone says they can't see any of the questions and answers.
I'm sorry to hear about that. We can post those along with the webinar recording. We should be able to download a transcript of that. And apologies for the technical issue there. Hopefully some other folks can see the Q&A. So let me see. One thing I also wanted to mention, so Jesus, you have a related research project. I'll put it in the chat, the policy brief at least. And this one speaks to community-oriented solutions, helping rural residents adapt to life without a car. And I was wondering if you just wanted to like speak to that connection. I'm personally curious what transportation planning organizations can do to sort of assess what the best solutions might be for their communities. Are there certain, you know, engagement opportunities for community feedback that are, you know, the best route to take?
Yeah. There are, and I think we're sort of looking at in another project specifically on sort of how organizations can work with communities, but I think the more community-led activities to kind of assess the needs for where they work and where they operate are important. So, for example, self-help enterprises has been kind of instrumental in both of our projects and kind of facilitating some of these transportation needs assessments and convening focus groups and interviewees and identifying challenges that their clients face. So I think that's a really promising solution. And then sort of the work that the agencies can do to meet people where they are, rather than sort of expecting folks to come to public meetings and that operate during business hours, attending and convening community events and providing things like food and for when it needs to be a public meeting, childcare services, transportation to those places, and paying people for their time. I think if transportation decision makers are expecting folks to spend their time and provide input into their planning and policy making, compensating folks for their knowledge and expertise is important for engagement.
Great, thank you. And I think we have time to answer one more question in the chat. This says, how did you inform residents of these new transportation options in their area? Did anyone in the interviews bring up information gaps in accessing transportation routes, info, or services?
I'm not sure who that is directed to.
Could be either, actually.
Yeah.
Seems like. Go ahead.
Well, definitely in San Joaquin County, we also reviewed needs assessments, and often, the transit needs assessments that are conducted. And many times residents would indicate that they would like transit in an area, but there was actually transit there. So the thinking was that mobility as a service app could help people use transit more easily. So a specific, especially in Stockton.
For us, that in the interviews, we did bring up the fact that Meocar was operating in the area, and some of the people we talked to were not aware of that service. So there certainly are information gaps on kind of the transportation services that are available. In some other related work where we're looking at adoption and barriers to adoption of electric vehicles in disadvantaged communities, same sort of thing, where people just don't have a lot of information about what EVs are and the costs associated with them and safety concerns and all of that sort of thing. So more information is needed on these newer services.
Yeah, and just to comment quickly about not knowing. So part of the challenge of these electric vehicle car sharing projects is being able to put them in, as I mentioned, a really accessible location where many more people will know about them. We have to, there are a lot of trade-offs that have to be made between meeting the requirements of the grant versus, the timeline of the grant and an extended process to work with the city to get a service in an area, and just the expense of installing EVSE. I mean, most of these communities just had one location.
All right, looks like we're at time. I want to thank Caroline and Jesus so much for your presentations and for sharing this important research. I shared a link in the chat for folks. Please fill out the survey. Let us know how we did and how we can improve in the future. And with that, I'll say goodbye and thank you so much. Have a great rest of your day.